Hello, everyone, and thank you for joining today's UMB ICTR Enrichment Seminar. Before we get started, just a reminder that this session is recorded and will be posted to the ICTR website in our education section for your reference. We are reserving the last 10 to 15 minutes for questions and ask that you post them in the chat or feel free to use the Q&A feature. Finally, as you leave this session, we will redirect you to a survey. We value your input for future presentations, so please take a moment and share your thoughts with us. And now I have the tremendous honor to introduce our guest speaker, Juris Doctorate Alice Middleton. Ms. Middleton is Hilltop's Executive Director. Just some quick background about Hilltop. UMBC originally established the Hilltop Institute in 1994 as the Center for Health Program Development and Management in a unique partnership with the Maryland Department of Health, acting as a nonpartisan health research organization dedicated to advancing the health and well-being of people and communities. In her role as Executive Director, Ms. Middleton provides leadership on programmatic strategy, direction, and delivery of client engagements for research, policy analysis, and data analytics on Medicaid, healthcare financing, and delivery system reform. In this seminar, Ms. Middleton will describe how the Hilltop Institute supports applied research and evaluation using large-scale health program and claims data, and how researchers can collaborate with translate analytic findings into actionable insights for communities and decision makers. The talk will highlight practical considerations for launching cross-institution partnerships and include concrete examples of collaboration pathways that can help ICTR investigators move efficiently from idea to impact. Now let's welcome Ms. Middleton. Thank you, Ms. Middleton.
Thank you so much, Wanda. I really appreciate it. And good afternoon, everyone. Thanks so much for joining me for the ICTR Enrichment Seminar today. As Wanda said, I'm Alice Middleton. I'm the Executive Director at the Hilltop Institute at UMBC. I'm also a University of Maryland, Baltimore alum. I am a graduate of the Carey School of Law. And I've worked in Medicaid my entire career, and I'm really excited to talk with all of you about that today and the work that Hilltop does. So I'm really happy that Dr. Davis invited me to talk about the work that we do at Hilltop and to let this ICTR community know about the potential collaborations we could explore together. At UMBC, as part of the ICTR collaboration, we support the cybersecurity, machine learning, and artificial intelligence core for the ICTR community. And 25 of our UMBC staff, including several of our Hilltop staff, have been awarded ICTR grant programs. So I'm excited to think about potential collaborations as we talk through the work Hilltop does today. So I'll talk about who Hilltop is, how we work with the Maryland Department of Health and some of our other state partners, and what this particularly means for researchers, particularly around data analytics and applied policy impact. Rachel, thank you so much for moving the slides for me. If we can go to the next slide, please. So again, I'll start with a brief overview of Hilltop and where we sit within UMBC. And then I'll spend most of my time talking about our longstanding partnership with Maryland Medicaid, the types of work we do. And then I'll wrap up with some data access and data request processes. And then we'll talk about, we'll do questions and answers at the end, as Wanda mentioned. Next slide, please. So let's start with the overview, how we're structured and what we're built to do. Next slide. So Hilltop is one of the largest research centers on the UMBC campus. We've got about 70 staff with a deliberately multidisciplinary mix. We have health services researchers, social scientists, public health professionals, economists, financial analysts, attorneys, and programmers. And this mix of really diverse individuals helps us to move quickly from policy question to analytic work to implementation. Our staff are really integral to the work of the Maryland Department of Health, and our leadership team includes over 100 years of Maryland Medicaid experience. We also engage students through many learning opportunities, hire interns, hire graduate research assistants, and many of our students end up staying on as full-time staff. We're guided by an external advisory board of nationally recognized experts. And I want to mention in particular that one of our advisory board members is Dr. John Mark Hirshon, who is at UMB, and he's been really instrumental in guiding our work with UMB and thinking through our strategic priorities. Next slide, please. So this is an org chart, and it just shows how we're sort of situated at UMBC and how our work's organized. So we're embedded at UMBC. We're led by Dr. Carl Steiner in the Office of Research and Creative Achievement. We have very strong support. You can see over there on the left of the slide from our UMBC DO-IT, Department of Information Technology, which really ensures and enables us to keep our data and systems secure. And that's kind of the hallmark of all the work that we do is really embedded with our data. And then we're structured around functional teams that support the policy, analytics, technology, and finance. All of these groups, so you can see at the bottom, they're all led by directors at our Hilltop team. They line up with the functions and subject matter expertise of the Maryland Medicaid teams. And so that structure allows us to support complex state partnerships while maintaining strong compliance, IT, and research standards. So just to go through those quickly, we have a technology and innovation programming group that really leads all of our things data, Medicaid policy studies, health reform studies, aging and disability, rate setting and finance, and analytics and research. Next slide, please. So our mission at Hilltop is to advance the health and well-being of people and communities through research and analysis. And our vision is to be a trusted resource for policymakers at the federal, state, and local levels. A key way we do that is through our longstanding partnership with the Maryland Department of Health, which really anchors a lot of our applied work. Next slide. So this is a slide we developed several years ago as part of our strategic planning exercise. And this really highlights the core capabilities that allow Hilltop to support real-time policy decision-making for the Maryland Department of Health. So we bring together large integrated data repositories, sophisticated analytics, and deep knowledge of state health policy, all within a public university setting. So that combination lets us move from policy questions to analysis to actionable support for programs, for rate setting, and for implementation of new programs or changes to policy. And then at the same time, we have really worked to expand our research and engage scholarship and really focused on increased student engagement. And that work really strengthens our evidence base, builds our analytic capacity, and creates opportunities for collaboration. So I'm hopeful this is where we can start to do more collaboration with ICTR as well. So we really try to contribute to the national discourse around all things Medicaid, all things healthcare. And then we also want to train our students. And as I mentioned, a lot of them end up working at Hilltop. We train them and then we hire them. But we also have a lot of people who end up working in state government. And so we train a lot of people who end up working for a lot of our state partners. So ultimately, all of this reinforces our partnership with the Department of Health. So it ensures that our operational work is rigorous, responsive, sustainable, and all the while advancing UMBC's mission of research, education, and public service. Next slide, please. So nationally, Hilltop participates in multi-state learning and research networks, including SUPLN, the State University Partnership Learning Network, and MODERN, which is the Medicaid Outcomes Distributed Research Network. And these are all convened through Academy Health, which many of you are probably familiar with. I currently serve as the SUPLN Steering Committee Chair, This is a group that brings together other state Medicaid partnerships, similar to the Hilltop Medicaid partnership. So it's a state university and a Medicaid program working together. So these networks really allow us to collaborate with other state university partners. We share methods, and we're able to accelerate evidence generation across states, particularly for Medicaid policy questions. So Modern has really allowed us to do that. We've developed a common data model and thinking through how we can look at other states in a quick way and get some results, so states can see how they compare to other states. Next slide, please. Next, I'm going to talk about our partnership with Maryland Medicaid. Next slide. So as Wanda mentioned at the beginning, Hilltop has a very unique 31-year partnership with Maryland Medicaid. We started as a really small collaboration between UMBC's former president, Freeman Hrabowski at the time, and the Secretary of the Department of Health in 1994. We had about 4 staff at that point, and we've since grown to be a really integral part of the Maryland Medicaid infrastructure. In the 1990s, we helped Maryland write their 1115 waiver, which is a waiver that allows the state to operate, instead of a fee-for-service program, they operate a managed care program. And that launched and was approved by the federal government to go live in 1997. And so as part of that, the department needed help with rate setting. They needed help with implementation of that managed care program. And so Hilltop was able to kind of grow organically as they helped the state bring up that program. We still work very closely with the managed care program, work on their rate setting, and do a lot of work with that program. So the work we do for the department is policy-driven, data-driven. We do a lot of quick turnaround to support real-time decision-making for the department, especially right now during legislative session. We have a lot going on. We're responding to requests from them daily as legislature is asking questions. We also conduct research and policy analysis, analytics and predictive modeling, actuarial and financial analysis, and program evaluation. We also support stakeholder engagement, and we maintain a decision support system. And all of this is backed by a really extensive data warehouse. We actually have the Maryland Medicaid data from their claims payment system going back to 1991. Next slide. So this partnership is really grounded in UMBC's public service mission, and then our shared goals with the state. There's a very strong commitment on both sides to data-driven policymaking. And our model, our agreement with the department is very flexible, and it allows us to respond to changing needs. So we have a very large scope of work for all the reports and all the analytics that we need to do. And we do all of that, and then sometimes they'll call and say, and can you do this other thing too? And we figure it out. The continuity of our partnership is really key, as we have a lot of institutional knowledge of the program, and we're also a cost-effective alternative to having to bid out a contract every year. Next slide, please. So while Maryland Medicaid is our largest partner, we also work with several other Maryland healthcare agencies. This allows us to support policy questions that cut across systems, such as coverage, cost, quality, and access. And it also improves our understanding of kind of the big picture of Maryland healthcare issues. So for the HSCRC, or the Health Services Cost Review Commission, we provide Medicaid-related support for total cost of care and the AHEAD models that you might be familiar with, which is their all-payer system. We work directly with the HSCRC on hospital community benefit. We do data collection and reporting, debt collection and financial assistance reporting, and several legislative reports. More recently, we've done a report on trauma funding, facility fee, Emergency Department Wait Times Commission. We're supporting that commission. And we also develop and continue to support a Medicare claims analytic tool for HSCRC. We've supported the Maryland Health Benefit Exchange since its inception. We provided initial staffing when they were just a very early stage agency. We drafted their initial blueprint reports. We drafted their federal establishment grant applications. And we continue to provide data analytic and policy support to the Health Benefit Exchange. For the Maryland Healthcare Commission, we format and provide the Medicaid data for inclusion in their APCD or All Payer Claims database. And then we receive a copy of the commercial data in the APCD to support our work for Medicaid and MHBE. We've also contracted with MHCC directly to perform various studies and staff work groups. Most recently, we've worked on an insurer consolidation report and a report on the cost of including biomarkers as a benefit. For MDPCP, or the Maryland Primary Care Program, we're supporting expanding the program to Medicaid under the AHEAD model. And we perform predictive modeling for participating providers, and we work with CRISP to push out actionable data to providers on people who are at risk of an avoidable hospitalization. Next slide, please. So there's a lot going on right now in healthcare, as I think everyone on this call is probably aware. So some of the current healthcare priorities shaping the state work right now, and the things that are really keeping us busy at Hilltop are listed here. So the state is very focused on protecting coverage under Medicaid and other sources of insurance coverage as we start to implement OBA, or the One Big Beautiful Bill Act, or HR1. OBA will require work requirements for the Affordable Care Act adults starting January 1st, 2027. It will also require that people renew their coverage every 6 months. These ACA adults will have to renew their coverage every 6 months instead of every 12 months. And so we are expecting that there'll be a lot of churn, kind of people in and out of coverage. And we have actually put together some projections on coverage losses, and those can be found on our website. We're working on executing and helping the state execute and plan for the AHEAD model. So this all-payer model has existed since 1977, and recent changes are going to be pretty significant based on the new federal requirements that have just been signed. So lots of work going on there. There's been a lot of issues around HCBS and the waiver eligibility processes. So we are supporting the state with data analytics on that. We are working with Carelon, who is the ASO, or Administrative Services Organization, who pays the behavioral health claims for Maryland Medicaid. So we're really focused on strengthening that system and making sure we're providing data analytics to support that. And then focused on Health Choice, which is the managed care program I mentioned earlier, to make sure that we are driving the MCOs to provide quality and savings for the state. Next slide. So I'll walk through some examples of our current work, and I'll talk through it kind of based on our program areas. Next slide. So for Health Choice, which again is our managed care program and has a couple of other pilot programs underneath of it as well, it's the 1115 waiver that allows Maryland to operate managed care and several other waiver programs. Hilltop supports a lot of this through MCO rate setting, financial analysis, and ongoing program evaluation. As I mentioned, we drafted the initial 1115 waiver application and the Health Choice regulations. We subcontract with an actuary to set capitation rates and provide certified actuarially sound rates to the federal government. So CMS gets these and approves these every year. We conduct CMS evaluations, produce routine reports, and we support special studies and legislatively mandated work. to support the department. And then finally, we maintain the MMIS data warehouse that allows flexibility as state needs evolve. So we have all of the data and we're able to look at it quickly and provide information to the department. Next slide. So as I mentioned, Carelon is the ASO that pays the behavioral health claims for Maryland Medicaid. There's a lot of data intensive work that's happening on these programs. We supported the transition. There was a different ASO before Carelon started, so we helped the state support that transition with data exchanges and data feeds. We help support evaluations for the IMD, which is the Institutes for Mental Disease 1115 waiver. We do evaluations for maternal opioid misuse program, and we also do a lot of overdose surveillance work and matching data to look at those individuals. Next slide. So for LCSS, Hilltop supports the HCBS waiver development and reporting. We support nursing home pay for performance, which puts about 1% of the total nursing home payments at risk and pays it back out for high quality nursing facilities. We have supported the state in expanding their PACE program, which is the program for all-inclusive care for the elderly. This is a small program, but it's capitated mostly for dual enrollees. We support DSNP or dual special needs plans coordination. And then we often support broader long-term services and support reform efforts. And we're constantly looking at cost and outcomes for these populations. Next slide, please. So for Developmental Disabilities Administration, we have a separate agreement with this part of the Maryland Department of Health. So our work with DDA focuses on analytics to support program development and sustainability. The DDA provides habilitative services to people with developmental disabilities through an HCBS or Home and Community-Based Services waiver authority. So our work helps with rate review, with development. We collect general ledger data from the providers for over 300 DDA providers that provide these services. And we support stakeholder processes and host the rate review advisory group at our Hilltop offices. Next slide. So we also support public health analytics beyond Medicaid claims. So this includes surveillance and screening programs, dental services. We recently did a big school-based health center project to support Anne Arundel County in thinking about where to put a new school-based health center, which was a statewide needs assessment, or that was a county needs assessment. We've also done a statewide needs assessment and lots of other work on school-based health centers. We've looked closely at immunization records and did a lot of work with this during COVID, but do ongoing work as well. And for all of these programs, we work really closely with the Public Health Administration in collaboration with Medicaid. And for all of these, we do data linkages and have to make sure, of course, that there's strong privacy protections and agreements in place before we do any of that. Next slide. So I want to make sure I talk about the cybersecurity and all of the ways we are super careful about all of the data that we have at Hilltop. So the data stewardship is foundational to everything we do at Hilltop. We are known as a trusted data partner of the department, and we are HITRUST I1 certified. So we work really closely, as I mentioned, with UMBC DoIT and with our internal Hilltop team. We use a combination of on-premise and HIPAA secure cloud environments to achieve security. And then our data organization is really tight, and it's coupled to our data use agreements. and all the legal compliance requirements that are through HIPAA. And we have dedicated staff on our team who handle security and compliance. We have a active HIPAA task force. I think I have a meeting with them later today. We meet monthly and make sure we go through everything. Next slide. So one of our primary decision support tools that we built for the Department of Health, we call the Data Port. It integrates multiple data sources and it supports modules focused on eligibility, Medicaid eligibility, capitation payments, so for our managed care plans, service utilization, what services are people receiving, long-term services and supports. We've looked at redetermination, so as people are renewing their coverage, how many are falling off, how many are coming back to coverage, and lots of different research modules. So it is designed to support both operational monitoring and analytic questions. So some are kind of short-term, what's happening with claims this month, and some are more long-term, how are people, what are outcomes, what kind of services are people getting over the course of a year. So we host a firewalled version for state staff. We've got close to 100 people at the Maryland Department of Health credentialed and able to log into this with very detailed data so they can look at it quickly. And then we also have a public version available on our website to help with public transparency and reporting, so people can get a sense of how the program is performing. Next slide. So this slide is a screenshot of our public data port landing page. So this system allows users to configure custom reports. People can look at the data by year, by geography, so at a county level, by coverage category, and by certain demographics. And it supports analysis of enrollment, utilization, LTSS services, and the health choice managed care plans. And then the data are updated monthly. We get a monthly MMIS feed from the department. Next slide. So here's just a screenshot of once you click in, this is what the data port looks like. So I encourage you to log on, take a look at hilltopinstitute.org and click there for our data port. I think there's a lot of really interesting information. And I think it'll spark a lot of ideas about things to review and things to look at and potential research projects involving Medicaid. Next slide. So next I want to talk a little bit about the data sharing work that we do. So part of our agreement with Maryland Medicaid is that Hilltop helps to manage the data sharing for external researchers, sister agencies, and federal partners. We actually fulfill these data requests on behalf of the Department of Health. So we currently support more than 75 active data use agreements. And we've worked with the department really to develop this data request process over the years. It includes a boilerplate DUA template, and this is something that we sign as kind of a three-way DUA. So one party is always Maryland Medicaid, one party is UMBC Hilltop, and then the external researcher or their organization is the third party. Next slide. So researchers can request Maryland Medicaid through the MDH website, and I have some links later on in the deck. And so as part of our work with the department, Hilltop works with the researcher on the scope of work and a draft budget to get access to that data. And then the department manages the DUA and IRB processes. And then we develop a service agreement, and then Hilltop fulfills the request. So I encourage you to take a look at the IRB website to look at the timelines, the requirements. And then I just wanted to mention also that researchers have to have a secure environment. I think you do at UMB, so that's good. And then all the safeguards to obtain the data. And then all of this is managed through the data management plan that is attached to the data use agreement. And all of it is reviewed by the strategic the Strategic Data Initiative team at the Department of Health. Hilltop also collaborates on studies with external researchers. So sometimes we just fulfill data requests, but oftentimes we are able to collaborate with researchers and help to think through how you might put a study together. So please reach out if there are projects you're interested in starting to think about. We're happy to start to discuss that. Next slide, please. So a clear scope of work is really critical in doing these data requests. It defines the study population, the time frame for the data you're looking for, the data elements you're looking for. And Hilltop assists researchers. We've kind of got it down to a science. We provide guidance, examples, data dictionaries, common requested variables, and I think we've really streamlined the process. So this is kind of the process you would go through when requesting the data. Next slide, please. So again, I won't go through all of these, but these are the links I mentioned. So how to request data, Hilltop's data page, what's already available, the MDH request form, and then some IRB information. Next slide, please. So separately from the Maryland Medicaid data that Hilltop houses, I wanted to also mention that TMSIS data is available, which might be of interest to researchers. And this is really the national Medicaid data set. So every state has its own Medicaid program, and states send their Medicaid data to CMS, the Center for Medicare and Medicaid Services, and it's aggregated for researchers. So you request this data through CMS, and you can request one state, you can request many states, you can request all 50 plus DC and the territories, and there are different kind of price points for all of those data sets. Some of you might have heard that in February 2026, HHS released some of the TMSIS data publicly, although I think as of today, haven't checked today, but in the last couple of days, it's unavailable. This provider level data set was released for transparency purposes to start to allow people to look for fraud. But it's very complicated, the data. And so I think it is highlighted kind of in the national conversation about why applied expertise and data quality review really matter. And so I think that HHS is looking to fix that data up and needs to check it before it can be re-released. Next slide. The other place to potentially access data is Maryland's All-Payer Claims Database, or known as the MCDB or the APCD. And it's maintained by the Maryland Healthcare Commission, which I mentioned earlier. It includes claims for fully insured plans and for state employees. It has a separate data request and fees to get the data. It does not include self-insured or ERISA plans. And so while Hilltop provides the Medicaid data for inclusion in the all-payer claims database, studies requesting Medicaid only would go to the Maryland Department of Health, but MHCC will handle requests where Medicaid and commercial data are required for the study. And then the Maryland Department of Health approves all of these. So I think my next slides are just my contacts and questions. So I got through that a little bit faster than I thought. So I'm happy to take questions or go back to anything that you might have questions about. I see a few things in the chat. But it doesn't look like there's any questions there yet.
Hi, Alice. I'm monitoring this. I don't see anything in the chat, and it does not look like we have the Q&A feature open, but Please feel free to either raise your hand or add your question to the chat. And if you have questions about the UNB secure research environment that we have, we can provide some information on that. I did add that link in the chat for your reference, as well as the Maryland Medicaid data port link. Alice, do you see that question from?
Yes, let me read it. So the question is, to access Maryland Medicaid data, what are the costs? Also, can you let us know what is the most recent year available at the moment? So the costs kind of vary based on what the request is. So I know that's not a great answer, but I'll say reach out to us. If it's pretty simple and something we've done before and already it's much cheaper. If it's very in depth and many years, and it really depends on what the request is. We try to work with researchers based on their budgets. And then the most recent year available. So typically we don't share data that doesn't have full run out. So because we're looking at claims data and it can take a while to process, we usually allow 12 months of run out for all fee-for-service claims, and then about 6 months of run out for managed care claims. So back up 12 or 6 months, and that's about the most recent that we usually release.
I don't see any new questions, so maybe this is a good time to end the session. I know that there is a town hall meeting going on at this moment about Title II, and probably some of our attendees are leaving for that. I just want to add in here that for any latecomers, we will be adding a recording of the session in our education section of our website, and I just added that link to the chat. And if we don't have any other questions, Dr. Davis, do you have any comments?
Yeah, thank you, Wanda, and thank you, Alice. A really wonderful seminar, and so grateful that you delivered that, and really look forward to very long and mutually beneficial partnership with Hilltop and UNBC.
Wonderful.
Thank you so much. Yeah, I think there's a lot of chances to collaborate, and we look forward to hearing from a lot of researchers out there.
Thank you, Alice, for joining us and providing all this information. And I know that the attendees and others who were not able to attend will be able to have access to this recording on our website. So thank you for this. We really appreciate you being our guest speaker today. Thank you.
Thanks so much.
All right, everyone, we're going to give you back the last part of this hour. Enjoy your day.